Aignosis is an AI-derived diagnosis. If we both said, we got a tummy ache, we're definitely dads of young kids, aren't we?
Tummy ache, yeah.
Yeah. The AI is going to ask us different questions because we have different demographics, we have different family medical history, we have different lifestyles, even though we can both say, my head hurts, my stomach hurts, my leg hurts.
Welcome to Self-Funded with Spencer, sponsored by Pareto Health, ClaimDoc, and PlanSight. Whether we're discussing innovative new healthcare strategies, exposing hidden revenue streams or misaligned incentives, or even just cheering on the next generation of this industry, we promise you that you're going to learn something. So thank you for joining us for another great conversation about the future of healthcare.
It's not just about taking benefit savings and applying it to more benefits. Sometimes it's about let's support our people and the company and our long-term vision. If we have more resources, we can do more things.
Yeah, I love it, man. I assume we're ready to go, right, Nathaniel? All right, well, so I'm here with Chris Mathew, the man with the coolest sneakers probably ever on the podcast, and also the co-founder of Sniffle. What's up, Chris? How are you, man?
I'm doing fantastic.
Well, great to have you, man. We've been trying to coordinate this for a while. I had the pleasure of being on your show a couple weeks ago, and you run a top-notch podcast, man, so thank you for that. And I'm excited now to highlight what you do. So, Chris, real quick, before we get into your backstory and who you are, could you give us like the 30-second pitch? What is Sniffle?
Yeah. Sniffle is an AI-driven virtual care platform that we've built. It's live and in the market. Sniffle stands to represent better care, bigger picture. Better care from the perspective of how do we support physicians and clinicians and patients in being proactive in pursuing better care for themselves, now short-term and long-term. And the bigger picture is to really reinforce the relationship between patients and their physicians and their providers. That we believe that we've got to try to help eliminate some of the bad business models that exist. I don't believe that random doctors should treat random patients in ongoing continuity of care. Okay. I don't think that transactional care is good for patients. And I know it's not good for physicians. Okay. So where I go to buy 25 pounds of macadamia nuts is not necessarily the same place that I should go get my health care. And so the bigger picture is we really want to help bring the patient and medical community back together and make that bond tighter. And we're using AI and advanced tech to make that happen.
That's awesome. And I'm glad you stressed the doctor-patient relationship. It's something we talk about quite a bit, and I'm sure DPC will come up throughout this conversation. But it's about the doctor's quality of life just as much as it is the patient's quality of life. Absolutely. And you're a better doctor if you have fewer patients and can spend more time with them, and the way that they access you, et cetera, is more convenient for them as well. So I can't wait to have this conversation, man. You and I have had a number of conversations. I think what you've built is really cool. Excited to finally highlight it. But let's hear your story real quick, Chris, because you haven't always been the co-founder of Sniffle. You have a lot of insurance and stuff in your background. So let's hear a little bit of your story, man.
Yeah. My brothers and I are first generation born here in the U.S. My parents come from Kerala in India, southern tip of India, right on the western coast. My last name is Mathew because even though in Kerala, the third most prominent religion is Christianity, it's still Hinduism, Islam, but Christianity. But in Kerala, it's the strongest concentration of Christianity throughout the country of India. So anyhow, that's why people are like, Chris Mathew, that's not really your name. And I'm like, well, it's actually Christopher George Mathew if we're going to be official. And they're like, that's not really your name. I'm like, yeah, it is. So my parents immigrated here. My dad came here first 46 years ago. Wow. My dad's no longer with us, but he came here first. He was sponsored by his uncle, my great uncle, which is who my brothers and I look to as kind of a grandfather figure. He's still with us. Shout out to Apacha, who lives in Richardson. And they came here to pursue the American dream.
So you've been a Texas guy your whole life then, huh?
Born and raised here in Dallas.
So did you ever spend any time outside of Texas? Or?
I did. I lived in Oklahoma for a little while.
Okay.
Lived in Wichita, Kansas for a little while.
Not Texas, right?
Not good for me. It's a bad experience for me. I only lasted there 6 months. Then I came back, running back to Texas.
I don't blame you. I spent 5 years outside of Texas myself for college in Springfield, Missouri. Not a bad town, but like you said, kind of meh. My wife didn't want to stay there. I certainly didn't want to stay there after college, and so we came running back to Texas. But didn't mean to derail you. I just had to test your native Texan cred here.
Listen, so we grew up in Plano, and where I used to go to do all the things we never wanted to get caught doing was Frisco.
Yeah.
And people are like, when we run around town, and my family and I, we live in Frisco, and people are like, oh, where are you all from? Like, here. Like, oh, no, but where are you really from? I'm like, oh, I grew up in Plano. And people are blown away, like, oh, you're actually from here?
Yeah.
Because there's so many new people that have moved in here. But, grew up in Plano, went to Texas A&M, got my first job in the physician recruiting space.
Okay.
As the story goes with every physician recruiting agency that's out there, 2 vice presidents work their way to the top, and they turn their guns and they say, we're going to go start our own gang. And that's virtually every big firm that's out there. That's what happened.
Okay.
So that was no different in my scenario. That led me moving to Oklahoma. Had a couple startups there that I was part of, crashed and burned.
Okay. Tulsa, Oklahoma City?
Oklahoma City.
Okay. Cool.
Edmond, Oklahoma, actually.
Yeah, I know exactly. I used to cover that territory significantly. I actually love Oklahoma City, especially.
Oklahoma City is fantastic now. It wasn't great for me as a 20-something-year-old.
Fair enough, yeah.
That was trying to grind a new startup and, had no money and just trying to figure out how to launch a business.
Fair enough, yeah.
So had an orthopedic surgeon that we had done business with and placed along many years before and said, hey, I've got a huge office space here. Come to Wichita. I'll put you up. Free office space. Let's see how this goes. I moved to Wichita. I moved into my apartment. 2 days later, Wichita experienced the worst ice storm they had in 2 decades. And again, I'm from here, but genetically, my bones are from South India.
Yeah.
So I am not prepared to be in a severe ice storm.
Did you have a no crap moment like, what am I doing here?
Absolutely.
Yeah.
But that real moment came a day later when the entire apartment complex lost power.
Yeah.
And I don't know how to drive in ice. So I pack a bag and I walk a couple miles to a Hojo, a Howard Johnson, and I check into a Hojo and they've got power. And I'm there for 4 days. There's a Sonic next door and I'm eating Sonic once or twice a day for 4 days. And at that moment, I'm like, what? What have I done? Who have I offended in the universe to put me in this position?
Yeah.
Once it all thought out, I gave it a good run. And 6 months later, I said, this just isn't for me. Came back here, living in Plano, had another startup in Salina. It's the only place I could afford office space.
You had a startup in Salina?
Yeah.
Okay.
So I had 6 startups that I tried to get off the ground, all various perspectives in the physician recruiting space. Ultimately decided I'm done. Mm-hmm. And I had a good friend of mine whose dad had an IT consulting business, and he was like, hey, my dad loves you. Come join us. Okay. And I run my mouth for a living. Okay, that's what I do. I'm not an IT guy. Even though that might be what, a lot of my people come from, that's just not who I am. So that was a short run, but my former business partner called me and said, hey, remember that other idea we came up with? I'm like, man, all we did was come up with ideas. Yeah. I'm done with all that. I got to pursue a real thing now. Well, he said, hey, I met some people. They gave us funding. Let's try this one more time.
Okay.
So I did. And I joined him, and there were 4 of us initially that started that, and I was a part of that organization, helped lead that organization for 13 years. Finally got it right.
Yeah.
Which was
one of the things I want to ask you real quick, just hearing that story, a lot of entrepreneurs might fail once and go, I'm going to go back to work. But you gave it multiple rounds, right? And so do you have any lessons that you've extracted out that you'd like to share, that perseverance of being willing to fail and then try again and fail and then try again?
Yeah. Well, the first is the reason for that for me is, my parents are immigrants. So I have this duty, and my dad was the oldest, and he kind of gave up his birthright by coming over here and pursuing this. So this business that my grandfather, his father, had built up, then got divvied up to all of his brothers. So he came here chasing this American dream. My dad sacrificed everything. My mom, same thing. So my brothers and I just feel like we have this responsibility.
Absolutely.
We've got this obligation. Not that they ever put it on us, but it's a self-imposed obligation that we have to succeed. And as much as my dad was like, just go work for a big company. Like, that's the American dream. I was like, no, we come from a family of entrepreneurs. My grandfather, his dad, was an entrepreneur.
Yeah.
The family are all entrepreneurs. So I'm like, this is built into who we are. My dad hated seeing me try and toil away, but the resilience factor was I believed in what I was doing, right? And so I think that's the biggest thing is it's sometimes important not to over drink your own Kool-Aid,
Yeah.
right? But it's also really important. You've got to be your own hype man. You've got to be your own cheerleader. And I can do that for myself. Like I can, if I see a solution and I say, oh my gosh, this is something that can really add value to people, I can withstand and I have a pretty good endurance and tolerance for pain. And so for that,
yeah.
I just kept going. Now, the one thing I would say that I would pass on to my kids if they were to try to go down this game of entrepreneurship is to recognize when it's time to fold shop.
Okay.
Because there is a time that you are going too deep in the wrong direction. And, there's this great visual that I've seen where a guy's digging for gold. And then he says, I quit. This is too hard. And the visual is like if he digs one more foot,
yeah,
all of the gold is sitting right there. The downside, and so along that path, you've got to be measuring, are we making progress? Are we making headway? There were times where I toiled away and the market didn't want the solution that we had created. But I thought, I got to keep going. So I would say to my boys and anyone else wanting to pursue entrepreneurship, you do need to have resilience, but you've also got to be data-driven. You've got to look at the data and find out from your voice of your customer,
sure,
is this really a solution that they see as a problem that they have in their everyday life?
Yeah.
Because if you've created this incredible thing, but no one really needs it, your passion, unfortunately, isn't being purposed properly.
Well, yeah, it's almost like you're fixing a problem that doesn't exist, right? Or other people don't perceive that problem to exist. And so no matter how passionate you are about it, that same analogy you used of the guy digging, and if he just dug one more step, he'd get to the gold. Well, he doesn't know that. And also some guy might be digging and digging and digging and digging forever, and the gold's way over there.
Right.
And you don't realize it. And so you spin your wheels so long and you miss out perhaps on what the opportunity costs to close shop and do something else as well.
Absolutely. And I know that we're both fans of Gary Vee.
Yeah.
Gary Vee really, in 2016, I saw him speak at a conference. I had no idea who he was. Yeah. And he was just yelling at the whole audience.
I was going to say, he's the guy that has been yelling at me about, not me personally, but yelling to make content. And finally, I listened.
Yeah. Absolutely. Yeah. Make content. And he's also yelling at everyone in the audience like, you're not even trying. You're not trying. You're playing this game with the mindset of days and weeks, maybe months. But real business is long game. And so it's this balance of like, oh, this guy, he gets it. And it's balancing that of also recognizing if your customers aren't really responding, you have to adapt.
Yeah.
And at some point, it might be the right time to take the lessons that you've learned from that business and fail forward into the next endeavor.
Pareto Health is the manager of the largest employee benefits group captive in the United States. And it's also now the main sponsor of the Self-Funded with Spencer podcast. I chose to partner with Pareto Health for three main reasons. Number one, their dedication to improving the world of health benefits. Number two, their mission to reduce volatility and to make self-funding simple for mid-sized employers. And number three, the strength and scale of their program. With over 2,300 member groups and more than $1 billion of stop-loss premium under management, Pareto Health is the most robust solution of its kind in the country, period. Stay tuned for more information because I'm sure I'll be featuring them on an episode of the podcast very soon. Visit Pareto Health at paretohealth.com or follow them on LinkedIn to stay up to date on the latest news and developments. Well, so then let's kind of pull ourselves up to present day, Chris, and talk about Sniffle. What was the origin of this concept, right? And, may talk about how it actually was formed first before we get into what it does.
Yeah. My business partner and the CEO of Sniffle is Rich Blanton. Rich got involved in telehealth about 2011. Okay. So he's been doing this for a long time. And he came up with the concept with another business partner that was really focused on the relationship of medicine. He looked at the business models of the early telehealth companies, and it really frustrated him
Okay.
That you had to you had to have a membership to be able to get care. Frustrated him. It also had doctors doing consults for $15 a visit, $20 a visit, and the physicians should be treated better than that. Financially, they have put themselves through an incredible burden with the amount of student debt. I mean, when I was in this space and really paying attention in physician recruiting, I needed to know these numbers a lot. But when I was in that space, the average doc would come out of residency. What do you think the average debt would be for a doc coming out of residency? This is about, let's call it 6 years ago.
6 years ago. Average doc coming out of residency, $350,000.
A little less than that.
Okay.
So about $285.
$285. Okay.
For primary care.
Yeah.
That's primary care.
And what would they hope to actually make when they're
starting salary about 6 years ago was anywhere from 180 to 200K.
Okay, so 285 in to get 185 to 200K or so out. Okay, which it's great money.
Listen, it's an incredible amount of money.
Yeah.
I'm not discounting that at all. But if you are on average somewhere between 30 to 32 years old, you haven't really earned money,
right?
But you have a debt monster of, call it 285, call it $300,000. You haven't purchased a house. You might still be driving the same car you went to college in. There's all of these milestones that you got to catch up on.
Mm-hmm. Mm-hmm.
So $200,000 a year is a lot of money, and a physician deserves every bit of that. However, with that debt monster, it's hard for the dollars and cents to make sense in medicine.
Yeah.
And the debt is a big issue for that. So anyhow, doctors doing consults for $20, we don't support that. We don't want a doctor to schlep their license. We want to also promote the relationship of medicine. Our belief, and for 16 years, I worked with physicians across the country, with hospitals and clinics, helping them grow their practices. So I feel like I can confidently say this. People got into medicine to be healers, to take care of people. Mm-hmm. Along the way, they want to make a great living and earning, and there's definitely physicians with huge egos as well, but there are huge egos in every industry. So that's not just limited to doctors. But for the real premise, I think they got into it to heal people. And with that, being able to do that and enjoy a certain quality of life and not be treated as a commodity and getting $20 a consult.
Yep.
That's the big thing that Sniffle stands to try to change, is to help physicians take back control of healthcare and say, I'm going to do what's right for my patients, and I'm going to be compensated for it appropriately. But more importantly, I'm going to also make sure that my patients, the longevity of their health journey is not going to be distracted by random healthcare that's available in retail centers across the country. Yeah,
so tell me about that. And it makes sense on the surface, but I want to hear from you the continuity of care component, why it's so important to you, like having a recurring, long-standing relationship with the physician. What is the goal there for you with Sniffle?
So one of the things that I've been really fortunate to learn from lots of people, brilliant people in my career, and when it comes to primary care, it is without a doubt the place that we can make, if we can make a significant investment in one particular area in our healthcare infrastructure that would have a huge ripple effect for the entire nation, it's primary care.
Yeah.
If we could unlock primary care to its full potential, we could really help people live healthier and have better quality of life across the board. So continuity of care is what primary care, and relationship of medicine, in my opinion, is what primary care stands for. It's about knowing your doctor. I talk about this. Our pediatrician, we have a great appreciation for her because she's literally been with our boys from the day they were born.
Yep.
She sees them sometimes multiple times a year, but absolutely at a minimum once every year on their birthday, to be able to know what's going on. Mm-hmm. That progress and what she's able to see and identify is huge for my wife and I. To be able to know and have confidence that here's a person that's been with this one for 9 years and this one for 7 years and knows the arc of their healthcare journey.
Yep. Yep.
And can then identify and say, this isn't normal. There is something additional going on here. And guys, we need to take a closer look. If I just go to random pediatric urgent cares constantly, I'm never going to have that baseline.
Right.
And I think that's what we need in healthcare. If we can have a medical home, then we'll always be able to know, hey, every January this happens to you. Your body resets from a big holiday season, and you go through this stuff, and this is typical versus this is atypical. This is not. We've never seen your data like this before. We need to investigate.
Yeah.
We need to do more.
Makes sense.
So that's why I think relationship is so important. And I love relationships. I think that in the end, relationships matter above all else.
Well, so when you and Richard were sitting down, right, obviously you said his background in telehealth, there's this desire for that, reestablishing or reaffirming the primary care and the patient relationship there. When did the tool itself, then this idea of Sniffle and the AI, leveraging AI, how did that formulate?
Yeah. So pre-pandemic, the tool was starting to be created. The pandemic accelerated everything because everything went digital. And so prior to the pandemic, Rich sent a survey out to 3,000 doctors asking, why aren't you more interested in telehealth? And the top two reasons, about 300 doctors responded, which in itself is pretty remarkable. But the top two reasons were the insurance payers don't want to reimburse, and the administrative burden isn't worth it. The juice isn't worth the squeeze.
Yeah.
I'm going to consume, if I'm going to get $60 on a reimbursement, I'm going to consume 60 to 70% of that through the administrative burden of filing it, chasing it down, correcting it, collecting it, et cetera. So it just wasn't worth it. Well, obviously the pandemic changed everything. Every carrier, every insurer, they were all on board with reimbursing for telehealth because everything was telehealth. So that was solved. And then what Sniffle did was started applying AI and machine learning to problems of how can we solve these other elements. So one of those was intake. Okay. So we've digitized the whole intake process. But what you mentioned or asked about was the tool, our AI symptom assessment tool. So we have termed it our Aignosis tool. Our stance at Sniffle, again, is to come alongside the medical community and to be a support and an augmentation to them, not a replacement. So our stance is that only a licensed medical provider should give you a diagnosis. But an Aignosis is what we think our clever little name is an AI-derived diagnosis. So our tool is built on over 14 million patient encounters that have been loaded into our machine learning protocol. And then this is where it becomes really powerful. Spencer, you put in your family medical history and your lifestyle, and then you put in your chief complaint or your first symptom. If we both said, we got a tummy ache, we're definitely dads of young kids, aren't we?
Tummy ache, yeah.
My tummy hurts. If we both say that our stomach hurts, the AI is going to ask us different questions because we have different demographics, we have different family medical history, we have different lifestyles, even though we can both say, my head hurts, my stomach hurts, my leg hurts.
Right.
There's a whole different series of questions that are going to be factored in because of our unique DNA.
Well, there's a baseline of a profile or variables that's already introduced before you even say your symptom, right?
That's right.
Okay. Yep.
The AI is then going to lead you through a medical interview. And that medical interview, it's branching logic. It's going to come and say, is your stomach hurting worse in the morning or the afternoon? Is it pulsing? Is it piercing? Is it on the left side or the right side? Is it all over? How much caffeine are you drinking? And it's going to keep asking these questions and getting more and more information from you. The returning set of differentials or the diagnoses that come back have a 95% accuracy rating, which is incredible. Now, there's some people that hear that and they're like, no chance. And my favorite thing to do is to have people test drive it.
Yeah.
Especially physicians. Right, we've been lucky. There's an incredible group of primary care docs that have been participating with us for several years. They've invested with us. They've helped shape the product to make sure that it really meets and fits a physician's workflow as well.
Okay.
But upon some of their investment, they were like, your cute machine's not going to out-doctor me.
Yeah.
And to which we say, of course not, because you're the doctor.
Right.
This is just a tool. In your hands, it becomes a powerful tool. But it's just a tool.
Yep.
So they would try to throw curveballs at the AI. They would try to throw in, answer questions a certain way and throw in additional symptoms and throw some things in there to see, will the AI catch this?
Yeah.
And the AI would catch the differentials. And they would look at each other and say, well, I'll be.
Yeah. It's almost like the doctor's Turing test, right?
That's right.
Yeah, that's funny.
That's absolutely right. And so when a physician can see that and say, this is what we could give our patients, that's when I see their light bulb go off and say, a new parent or a parent taking care of an elderly parent or just anybody in any stage of their life, for them not to have to go to do a Dr. Google scroll or a WebMD search that leads you.
I was going to comment that as a WebMD, right? It's like, it'll give you whatever response based on your prompt, right? And your whatever verbiage you use, not really take into anything else into account and give you some, possible symptom or possible diagnosis. But the differentiator for me in having seen Sniffle operate is that it's continually following up based on your responses and fine tuning and probably pivoting, based on the follow-up response. Oh, actually, maybe it's this instead. And it's going the direction it's supposed to go rather than leaning so much solely on your initial prompt, right? And I think that's why if I go to WebMD, I get a response from you have a rash to you might have cancer, right, based on my prompts. And this is so much more fine-tuned and specified than that. And so that's where I think that's truly different than what's out there today.
It's huge for that reason, because it's large data.
Yeah.
Right? And when you have big data, then you can be more precise. I mean, again, in the insurance world, we know this. The law of large numbers allows us to be more precise with our predictions of what will happen. The same thing exists in data applied to in healthcare. One of the things that I think is really powerful with our Aignosis tool is, and this is on both spectrums, you've got people who are hypochondriacs, right? And the term is cyberchondria.
Okay.
They just scroll and search for everything and think, oh my gosh, this skin rash must be, it's all coming to an end, and they overreact. What if we give them a tool to help them realize, no, it's just a rash. It's not anything that's fatal. You're going to be okay. If we could give that kind of empowerment and a tool to someone that they could then realize, okay, I'm going to be okay. To also give it to the other end of that spectrum, which is people that dismiss everything. I'm going to be fine.
Yeah.
Nah, it doesn't matter. I mean, it hurts, but it doesn't hurt that bad. My stomach hurts. Well, you know what? It might be indigestion. It also might be appendicitis.
Yeah.
And if we don't take this seriously, that thing that you're going to shrug off and be like, I'm fine, I'm a man, I'm going to rub dirt on it and keep on going with my life, could have you in the hospital in a very severe situation.
Yep.
Let's not allow people to have to guess or overinflate or underestimate what could be happening in their health journey. Let's give them tools that allow them to have accurate assessment of what's going on in real time, and then allow them to take the right next step.
Well, so that 95% accuracy rate, and I think you said, 14 million?
14 million and growing.
And growing, yeah. So can you fine tune it even further to iterate to 96, 97?
Yes.
I mean, with theoretically assuming 100% accuracy is never feasible, right? But is there a point when it's as accurate as it can possibly be? And if so, how do you get there?
You keep feeding the data. So the answer is, you're correct to say that we will never arrive at a place that is just 100% foolproof.
Right.
Because the data is always going to learn, and conditions change, right? Health is evolving. There was a pandemic a few years ago that changed everything. So we're never going to know all the things, but as the more data goes into it, the more precise it will be.
Sure.
So yes, I fully expect that it will be 96, 97, 98%. Once, today 14 plus million, when there's 40 million patient encounters in there, our ability to identify and be even more precise is absolute. So again, the law of large numbers allows more precision to take place, and that's the
Well, and
ultimate.
contrast that to if I was using a ChatGPT as an example, right? Which I think you've used as an example before, right? If I were to put symptoms in there, it might be a little bit better than WebMD, but it's going to get nowhere near the accuracy rate that you guys have curated, right?
Correct. Yeah. Now, I will say ChatGPT has made significant progress.
Okay.
And also, when you put a tool in the right person's hand, it becomes something different.
Yeah.
Right? It becomes a craftsman's tool versus just a tool. So I look at that and I think about that as people are using AI. If you put an AI tool in someone's hand who really knows how to get the best out of it, ChatGPT can be really powerful. You
Yeah.
put the right prompts in there and you help identify and give it, and you feed it good in, and you're going to get good out.
Of course.
What's different about ChatGPT from ours is it's open source. It's just going out to everything, capturing anything that's been published online, and then deciphering that. And if you give it more specific prompts, it's going to be more specific on what it returns. The difference of what we have is ours is 14 million and growing patient visits.
Yeah.
And the data from patient visits. Obviously, de-identified and HIPAA compliant and safety and protocol, all of that is always maintained. But this is healthcare data versus internet data.
Totally, yeah.
PlanSight is a complete game changer in the world of insurance brokering. As a broker, you know how time-consuming and error-prone the traditional RFP process can be. But what if I told you there's a better way? PlanSight is the only end-to-end RFP solution on the market made specifically for benefits agencies. It's like having a superpower that gets you an average of 8 to 10 hours back per employer renewal per year. And the best part? PlanSight supports all carriers, all funding types, and all group sizes for over 20 different benefits. If you're ready to make your RFP process faster, more efficient, and more profitable, it's time to call PlanSight. Visit plansight.com now to book a free demo and discover the future of insurance renewals.
Well, and I think one of the things I think maybe will give us a good transition here, because we've talked about perhaps the patient side of the equation, and you were very careful, and I'm glad you did, to say this is not a displacement tool for doctors. There shouldn't be any sort of resistance or hesitancy to use it, because it's really augmenting their experience. And so when you walk me through it, and I'm sure you'll describe the process here, but it's like you first have that narrowing down of what the potential diagnosis is, and let's assume it's got a 95% accuracy rate. That is going to ultimately transition into patient interaction with the doctor, correct? So you're empowering them with this information as a precursor to a visit, right?
Correct. The patient who's either doing an assessment for themselves or a loved one or a neighbor or a church member, whoever it may be, will then be prompted, if they need to schedule a virtual appointment with their doctor. Again, if we go back to the premise, it's about continuity of care.
Yep.
So I don't want Chris to just see any doctor. I want to see Dr. Spencer, my doctor. By the way, congratulations, you're a doctor now.
Yeah, thanks, man. 300,000 in debt, too.
You better start selling a lot of Pareto
Podcast
deals.
episodes,
Yeah.
or podcast and Pareto deals, yeah.
We want to be able to say, hit this button and schedule an appointment with your provider. If your provider is not on Sniffle, hit another button and send an invite to Dr. Spencer and say, hey, I want to start seeing you on Sniffle. It's this new platform that gives me all these benefits. If we do our job properly here at Sniffle, we're creating awareness with the medical community and allowing physicians and practices and hospitals to see the benefits of what Sniffle can do for their patients, and keeping that patient-physician bond reinforced to one another. You hit that button, you see the doctor's schedule if you're booking a virtual appointment with your doctor, and then if you're using insurance, great. We're integrated with 800 payers, including Medicare and Medicaid. If you don't want to use insurance, you're going to see that physician's cash price. It's going to be clearly listed there. If you can't afford to see your doctor and pay that cash price, then you might look for another virtual care provider on there. There are a lot of people who don't have a doctor. And so maybe you don't have a doctor at all, and you want to go on there and you want to find a virtual care provider that will be your VCP, not your PCP, not your primary care provider, but what about a virtual care provider? That is a very phenomenal thing for a family to have, is a go-to person to be able to rely on. If you don't have the benefit of having a go-to primary care doc that you in your community that you've got a relationship with, then maybe a virtual care provider can be a close second. I'm not here to share or believe that virtual care can solve all problems, but I do think that it can do a lot to help.
Yeah.
And so you can hit a button in the app, you see the doctor's schedule, you pick an appointment time, and then you're in a virtual consult. At the end of that, for the physician, what we digitized on the intake side, which the feedback we get from the medical community is really that they love this. When a doctor enters a virtual consult, that patient has their insurance eligibility has already been completed. because we're integrated with 800 payers and Medicare and Medicaid, the patient takes a picture of their insurance card if they're using insurance, and in 3 seconds I can pull back all plan details.
Okay.
So the doctor isn't having the front office staff calling, hey, is Chris Mathews eligible, insurance eligible? And then they spell my name incorrectly and they say, hey, Mr. Mathew, your insurance isn't eligible. Oh, did you put 2 T's and an S in there? Yes, we did. Okay, well, my name is 1 T, no S, which happens all the time.
Yeah.
So then all of that back and forth is eliminated because we've solved for that. HIPAA and informed consent documents have been signed off and completed and are in the app.
Okay.
Payment method has been verified and is completed in the app. And the physician or the provider is seeing this patient pre-assessed, diagnosed.
Yeah.
All of the family medical history, all of the lifestyle, the chief complaint, and how they answered every single question flows over to the doctor.
Okay.
So now before the doctor enters that virtual consult, she gets to see, she's not starting this conversation off with, Chris, why are we here today?
Yeah.
She's starting the conversation off with, Chris, I don't like what I'm seeing here. This isn't normal. How bad has this pain been? And now we're in a more meaningful place because she came into the appointment more informed about what's going on right now in my health journey.
And what does that data set look like? So if I'm the physician who's now scheduled for a meeting, I'm preparing probably the 5, 10, 15 minutes before for my appointment. I've got this patient. This is the supposed condition or the possible diagnosis. Are they seeing the entirety of the prompting in the back and forth, or is it a summary?
No, they get to see all the questions, all the answers from the patient. In addition, let's say it says, the top differential, most evidence for acute bacterial sinusitis. And let's say it's a new graduate, nurse practitioner or PA that is seeing this patient. And let's say this patient is 39 weeks pregnant and they're like, acute bacterial sinusitis. I wonder what treatment protocol I could assign to a woman this far along in her pregnancy. Mm-hmm. We also have AI purposed on the provider and physician side. So on the clinical app, the provider could enter in, what's the treatment protocol for a 39-week girl pregnant presenting acute bacterial sinusitis? And then the AI will bring back and say, here's a treatment protocol plan. It's not to usurp the clinician. It's to help the clinician can validate that or reject it.
Yeah.
Right? Or the situation could be, hey, Chris, we really need you to be eating better. Okay? You got to start eating a keto-friendly diet. No, I don't know about that. I'm not sure I'm going to eat fruit. I don't want to eat fruit all the time. It's just not for me. Okay? AI tool. I want a keto-friendly diet for a 43-year-old with this kind of a background who does not like fruit. Why do we need a physician or anyone else to put that together? Immediately, the AI can bring back, okay, here's a 10-day diet plan. Go and do this, follow this. Where I see the future is, and I learned this from Dr. Harvey Castro, who is a genius guy, both a physician and a technologist, very involved with ChatGPT in healthcare. And he was a guest on our podcast, and he was talking about, what if we take that scenario, come back with a keto diet plan, and then we integrate that with Instacart.
Okay, interesting.
And now it's like, hey, Chris, you're going to make excuses possibly on why you're not going to follow this. You're like, I don't have time to go to the grocery store and shop for all these things. Okay, great. Here's the meal prep that's needed for this 10-day plan. Instacart integration.
Yeah.
Right. The whole world is now about APIs and integration.
Absolutely.
What can you integrate with? APIs within Instacart are absolute. Integrate that, have that food delivered. I get home from my physician appointment and I have a keto friendly. I still got to make the food and do all that, but man, we sure are making this easy.
You close the loop, right?
You close the loop.
Yeah. Well, I even think so. Let's talk about the prescription side of that. So let's presume I, have, I don't know, you mentioned sinusitis, or I have some sort of sinus infection, and so an antibiotic is indicated. How do you guys handle or facilitate that procurement all the way through? Here is the prescription you need. It's being sent here. It's being paid for, et cetera, et cetera. How's that process work?
Let me back up and then I'm going to answer that.
Sure.
So when a physician onboards themselves through the Sniffle we're a marketplace model. We have Sniffle for Providers is the physician and clinical app.
Okay.
And Sniffle for Patients is the patient app for the rest of us. When a physician downloads Sniffle for Providers, they can onboard themselves in less than 15 minutes. They could go through a credentialing process in less than 15 minutes.
Okay.
In less than 24 hours, they will be delivered and granted the authority for e-prescribing, and that's backstopped by SureScripts and the DEA.
Okay.
So you can go through that whole process and never have to talk to anyone, not even us at Sniffle. That's pretty significant. If you've ever talked to folks in healthcare, the credentialing process to get a physician onboarded and integrated is a huge beating. So being able to digitize that is a huge thing.
Okay.
So physicians and providers can deliver scripts through Sniffle as well. So in this scenario, you come in, you have sinusitis, they want to prescribe antibiotics. On the patient app, and the physician has access to this as well, but there's what we call Sniffle RX. Sniffle RX is, now again, this is where I try not to always drink my own Kool-Aid, but it's
Drink
also,
it, man. It tastes good.
It also happens to be true. It's 4 times more powerful than GoodRx.
Okay.
GoodRx pulls from 1 ppm, and I know you know all about that, and we pull from 4.
Okay.
We can save up to 85% on prescriptions. But here's the powerful thing for the patient. I'm going to write you this script. Spencer, where do you want this to go? In real time, you can put in the name of the drug, the dosage, and how many times per day the doc wants you to take it. Put in your zip code, and then as close as 5 miles around you, it'll pull up every pharmacy and show you exactly what they sell that drug for.
Yeah, it's awesome.
So your ability to then say, the doctor may say, Spencer, do you want me to send it to Kroger again? And you may say, no, send it to this CVS because it's $37 cheaper there. And I know, again, your audience knows about this spread pricing and the absurd markup on some of these. My son is on a monthly medication that used to cost us just under $50 a month. I use Sniffle RX for him, and we get it for $8 a month.
Yeah, I believe you.
And that is an incredible amount of savings. That's just one script, right? I think about the average household in the U.S. has 4 prescriptions a month that they utilize. The Sniffle RX card alone is something that we're really proud of because that savings is impacting my family. We've got lots of testimonials and stories of people that are saving dramatic savings because they're using this card, which is amazing. So, yes, you direct and say what's the most convenient place for you. Your doctor sends the script through the Sniffle platform. It's delivered to, and you pick it up from whatever pharmacy you prefer.
ClaimDoc is a medical claim auditing and member advocacy company. We provide fiduciary services to employer-sponsored benefit plans and allowing them to create an environment where we ensure that the benefit plans are being charged on a fair and reasonable basis.
My business is basically people, and it become a real simple transition. We thought it was going to be far more complex. I've saved, we'll say, hundreds of thousands of dollars. I could not say enough about ClaimDoc.
Well, so let's talk about the experience now. I think that's a good segue into that the patient experience, the doctor experience, but being a consumer, right? How would I, as a person that's listening to this, or maybe a consultant that's hearing this and go, that would be great for my groups. How do I engage, and how would this onboarding process look like? So we talk individual market, and then we could talk group market as well.
For an individual, it's literally as easy as you download Sniffle for Patients in the App Store or the Google Play Store. And then it's there. The 2 things you get immediately, and our gift to everyone, is the Aignosis tool.
Okay.
There's no charge for that. Unlimited utilization. The reality, when I put that information in, there's opportunity to learn. And so there's the opportunity for the system to continue to get stronger. It becomes really strong when the person identifies who they are, to be able to say, because right now you can go in there and you don't have to say that you're Spencer. You do say that you're a male. You do say that this is your age and this is what's going on and these are the symptoms that you're saying, but the data is learning from that.
Okay.
So the Aignosis tool, unlimited utilization, free of charge. Same thing with Sniffle RX. That's available for anyone and everyone across the country.
Okay.
The benefit package that we sell inside of Sniffle is Sniffle Benefits. And I spent time, as you know, at Sun Life doing ancillary group sales. We're not here trying to do more than what we can, right? There's lots to fix in healthcare, but we're staying focused on what we believe we can actually move the needle on. So in Sniffle Benefits, for an employer, it's $15 a month that the employer pays to cover their employees. That $15 a month covers the employee and all dependents in the household.
Oh, wow. Okay, I was going to ask that. Okay.
So $15 covers dental, vision, behavioral health, labs, imaging, health advocacy, and unlimited virtual care appointments.
Okay.
All in $15 a month. Now, it's not insurance. And I will tell you, the Pareto principle is very applicable to when I've shared this with brokers that I used to work with, right? The transactional broker mindset has told me, hey, take that idea and throw it away. Because I'm not going to take a 20%. I make 20% commission on my dental and vision policy. I don't want this incredible deal that you have that covers a family for $15 a month. Sorry, I kind of get a little excited about that,
okay.
and I go down that path. But the let me go back to the benefit package. It's dental, vision, behavioral health, labs, and imaging. For the dental, our dental partner is Aetna.
Okay.
Go to any of the 260+ thousand locations that accept Aetna dental fee access schedule. Show them the Sniffle card in your app. Normal cleaning is $75. You're getting it for $30.
Okay.
You're saving up over 40% on braces for kids and adults. Here's the best part of the dental plan, in my opinion. There's no waiting period. There's no limitation. There's no maximum. There's no out of network. So even if to see how this would work with a fully insured plan, again, working in that space for a little while, I know that a really watered down plan to try to keep costs as low as possible would have a 6-month waiting period, no ortho, no crowns.
Right.
Most things move to class 3 and a $750 max. The moment you cross $750, you're paying 100% out of pocket. Well, to keep that cost down, okay, I understand sometimes that's necessary, but if you had Sniffle Dental to backstop that, especially for those family members that need a crown or need dental or need care over $750, here's the opportunity to go and access your oral health, which is directly connected to your overall health journey, and be able to do that in a cost-effective way.
Yeah, I'm even looking. It's not as it's in conflict, and not even like I'm like, oh, well, you can't. How? It's more of, how's it possible to deliver that extent of discount benefits and the access to unlimited, telehealth visits for only $15 a month? You're probably going to have some people that are skeptical, right? So talk a little bit about how that's possible to put that all together for $15 a month.
Yeah. It's the law of large numbers. It's the whole premise behind insurance. You're going to have some really high utilizers. You're going to have some really low utilizers.
Right.
What backstops us is a phenomenal DMPO company, a discount medical product offering company.
Okay.
Organizations like this have been around for a long time. This partner of ours has been around for 30+ years. They do an exceptional job and they've negotiated a lot of these contracts. What we've done is take those contracts and put them into our ecosystem, put our UI, UX on top of everything, put our AI on top of everything, and brought out this whole ecosystem together.
Right.
The solutions have been in practice for a long time, 30+ years. The vision network, the dental network, the behavioral health network. I would love to talk about the behavioral health network because I think that mental health really deserves, and it's getting more of a spotlight than ever before.
A lot of attention, absolutely.
And I think it is necessary, and we need to do that for each other and for our communities and for our friends and families. But these organizations have been around for a long time. What we've just done is said, we're going to bring this all together and create it in a household name, a playful name, a fun and memorable name, Sniffle, and we're going to make it phone first, mobile first. We're going to put the power of all of that in the palm of your hand. So if you need to find a dentist, you can do that with a click of a button. A vision provider, a LASIK surgeon, a behavioral health counselor, a place to go get your Quest diagnostic labs. All of that is done at the touch of a button. But also, you can save a bunch of money on your prescriptions. More importantly, you can have peace of mind of what's going on in your healthcare journey with Aignosis. And you can then go back to your physician virtually and say, Doc, I'm concerned. And then your provider can help navigate this process alongside you.
So what happens in the event, though, that somebody signs up, and I think you may have touched on this, but I want to expand on it. I want Sniffle, I pay for the discount card, I go through the process of the Aignosis, I found out I probably should talk to a doctor, I look up, my doctor's not there. So what is it, you mentioned perhaps it'll send a message to them, but that onboarding process, they could say no, right? Like, so what's the process of trying to get that Uber problem of user, drivers, and riders, right? Like, tell me about how you guys scale that up on both sides of the equation.
So the patient would say, I want to see Dr. Spencer, but he's not on here. So they fill out a form in the app and say, Dr. Spencer is my doctor. We reach out to Dr. Spencer and introduce who we are. And we say, you have patients requesting to see you via Sniffle. This is who we are. Mm-hmm. This is what we believe. We believe that we don't want your patients to be distracted and go somewhere else. We want to bring them to you. This is why they're asking for this.
Yeah.
These are the benefits of the ecosystem. I'm wearing this shirt that says 15-24-0.
Yeah.
15 minutes or less, you're onboarded. 24 hours or less, you are writing prescriptions through the app for a total investment of $0.
Yeah.
The issue that we've had with brilliant people like physicians is that's too good to be true.
Yeah.
Especially when all other EMRs come with huge price tags, huge implementations, painful processes to implement these solutions. What they're not realizing is with the advent of AI and the use of advanced tech, you can streamline all of this process. Mm-hmm. And we've done just that. So we're really trying to show them the heart we have behind this. One of the ways that we do that is we were at the Texas Academy of Family Practice, their annual summit at the end of last year. Every major hospital system in Texas was there. Big Pharma was there. Medical device companies were there. We were there. And the physicians got to go around and they voted Sniffle as best of show.
That's awesome.
Which was incredible. It was really validating for us as well to hear physicians say, this is what we want for ourselves. But also, more importantly, this is what we want for our patients. Mm-hmm. And so to get that and to hear that and to share that why with them in person, really the reverb that came back from that was to say, we're on to something here. We know that this is the right path. This has been built by physicians from the beginning, and they said so, but you know what? They're part of our team. And so maybe they're drinking the same Kool-Aid we're drinking. But to go out and have physicians validate that is how we're going to go back to the market. So if a patient says, my doctor isn't on here, we can reach out to that physician and say, here's who we are. This is what our North Star is. This is what we're trying to do. There is no catch behind this. You really get to share this with your patients at $0. And by the way, we sell a Sniffle benefit package in here. It costs $15 a month. And if your patient cares about saving money on dental, vision, behavioral health, great. None of that impacts your practice. But what it does do is keep that physician coming back to you, doc.
Yeah.
And keeps that continuity of care in that relationship.
Well, so it's a certainly compelling story, and I've seen it in real time. You gave me the demonstration, and I got to even see what a mock doctor-patient interaction looks like, so I could actually close the loop on my understanding of it. But so let me ask you this, Chris. You guys have had some early, obviously, success. You've had some recognition and things like that. What does a moonshot look like for you? Like, what would be a home run with Sniffle?
The moonshot is that people will be more proactive. And that health advocacy and health equity is a big thing for us.
Okay.
My dad passed earlier than he should have.
Okay.
He'd gone to the doctor 3 times in a 10-day period of time. And on the 3rd visit that they still sent him home, he'd passed away at home from a heart attack. It took me a while to get through to this place where I could put all of his data into the system.
Okay.
And go through an Aignosis. And I've done that now a lot. And continuously, it keeps coming back that this person should have gone straight to the hospital.
Yeah.
Now, I don't know if my dad would still be here with us or not. I hope that he would be. But here's what I do know. Being able to give people the opportunity to be advocates for themselves or for their loved ones or for their friends is something we should do. Mm-hmm. And if we can put this tool in the palm of more devices and in the palm of more people's hands, then it's not about challenging physicians, because I love physicians. Mm-hmm. I'm pro medical community all the way. But it's about being able to help people seek that second opinion. Now, again, AI is not to replace a doctor, but AI can gather lots of data and come together. When I put my father's information in, the returning set of differentials, most evidence, heart attack. An above 65-year-old on high blood pressure medicines, diabetic, with a family of heart disease, whose father died from a heart attack, comes into the office complaining of chest pain, and you do an EKG and find a right bundle blockage, you do not send that patient home. There was a strong relationship between my dad and mom and their provider. There's long-term continuity of care, 25-year relationship. Yeah. But the advocacy wasn't established because we accepted what the clinic said. Versus if my dad would have had Aignosis, maybe he could have run his own symptoms.
Sure.
If my mom would have been said, I don't know. If I would have had it for sure, I would have said, I don't know. And then we would have had the opportunity to do something about that. The moonshot here is, how do I get this to everyone so that people don't have to wonder, could we have done something more proactive to keep that person that we love with us for longer?
Well, you know what, that story, thank you for sharing that story. And I know it's probably a hard step to do, to, like you said, to put his data in and run it and just to see the outcome, which you presume probably was going to be, that you already knew that the tool was going to tell you what was happening. That's got to be really hard, man. It reminds me of, I had Andy Bonner on last year as the CEO of Healthcare to You. They're a virtual primary care network of physicians. He had a very, I wouldn't say not a similar experience in terms of the extent of the condition, but he had an ongoing oral problem where they could not tell him what was happening. He went to like 12 different urgent cares over the course of months. He was always on the road, so he had no continuity of care. And then ultimately, I think it ended up being some sort of oral cancer that he experienced, but it was misdiagnosed over and over and over again. And that frustration was part of what led him to start Healthcare to You. It is a very common recurring theme on this podcast for entrepreneurs in the healthcare space to have a why that's profound enough that compels them to go fix a part of the system. And so I'm glad we got to that. I didn't even have to ask you what your why is. Ultimately, obviously, it came out. But I mean, I hope everything that you're telling me just makes sense, dude. And I'd say, dude, I sometimes get into that mode, but it just makes sense. When you almost get frustrated, it's like, why haven't we just done this before, right? Why is it so obvious that, even thinking there could be resistance to something like this is mind-boggling. So, as we move to the end, and I want to talk kind of big picture of healthcare, you told me your moonshot, but is there, if you could look backwards and go, we fixed this, or we got this in the hands of X number of patients, or this has now become the standard of care, is there anything technically you could look at and check a box and say that was a success?
It's a good question, Spencer. I don't know that there is, this is a pursuit and not a destination. Mm-hmm. What Sniffle is trying to do is to be of service to people that can afford healthcare and people that cannot, people young and old, aren't fully bilingual in Spanish. One of the things we're really proud of is that there's a marginalized population, a large population in this country that doesn't know how to navigate the healthcare system. We want to do that. And so the pursuit is, how do we make change better? And I will say this, maybe this is my moonshot. If I can hear from physicians that can say, I have found a way to incorporate joy back into my practice of medicine again, then we will have nailed it.
Yeah. Then
we will have done this incredible thing, because I've worked with physicians, thousands of physicians across the country, and there is a consistent theme of like, this is hard, I'm burning out, I'm not sure why I'm doing this. If we can help them find joy, that joy, the trickle down will be, then they get to give better care and better interaction, because that fuels them being happy.
Yep.
That patient's going to be happy. Hopefully that patient's experiencing better outcomes, which fuels that doctor's joy. If people are getting better outcomes and we're using tools to help people live, not necessarily longer. You've mentioned this before. It's not just about longevity. It's about the quality of those years. If we can help people live happily and joyfully, then that's everything. How do I know if we've arrived there or not? I think it's just a matter of, if we hear the medical community say, yes, this is helping us. Yeah. If I can hear a CFO say, I got to give Sniffle benefits to not only my full-time employees, but to my part-time folks, to my seasonal folks, to people that volunteer for us.
Yeah. We
got to roll this out to them. It's $15. But the impact it can make for an entire family is so tremendous. We want to do that.
Yeah.
That fills my cup in a huge way, because I've seen both sides of this. Someone who's been a patient that's had a horrific experience, but also someone that's served in the employee benefits space, and I'm seeing how hard it is to try to thread the needle to offer rich benefits, but to do it in a cost-effective way.
Yeah. Well, I love it. I don't even need to ask you your closing thoughts, man. You instinctively did it for it. But I do want to ask, if people are interested, and I presume they definitely will be, best way to get a hold of you, reach out, get connected with Sniffle right away. I mean, you can onboard yourself kind of autonomously, right?
Yeah, I mean, honestly, here's the thing that I really kind of seals the deal for me when I'm talking to a physician group, is download Sniffle for Patients. And in there, you'll see what our intention is. Mm-hmm. You'll see what we represent and who we are and what we believe and the experience we're trying to bring for people. I'm happy to talk to anyone. You can connect with me at chris@sniffle.com, or I'm on LinkedIn. I've been on LinkedIn long enough that I'm just linkedin.com/Chris Mathew.
Oh, look at you, dude.
Yeah.
Okay. And Chris Mathew with 1 T, no S.
My man.
I've heard it enough now, because you had to correct people your entire life, right?
My man.
Yeah. All right, Chris. Well, I wish you nothing but the success, man. I really do. Go get steak after this, man, and then have a good time. But it's been a pleasure to get to know you the last few months, man. I'm really excited that fate brought us together to get to know each other, and I'm really excited to release this episode too. So thanks for coming on, man.
I appreciate you very much.
My
Thanks,
pleasure.
Spencer.
Yep.